In the news, TV celebrity Sharon Osbourne has just announced that she had a preventative double mastectomy after learning that she carried a mutated gene that gives her a much higher risk of breast cancer. We're talking via Skype with Dr. Lisa McGrail, a medical oncologist at George Washington Medical Faculty Associates, about Osbourne's decision and what women need to know when facing this kind of decision. Thank you for joining us, Doctor.
Thank you for having me.
Are these types of procedures, are they becoming more common?
Yes, I think they are becoming more common, and predominantly for two reasons. The first is we're better able to identify women who are at high risk for breast cancer, and the other is the advances that have been made in plastic surgery.
Well, what is the test called, or what is the gene called that determines this risk?
So my understanding is that Sharon Osbourne was talking about a specific breast cancer gene. So likely that is either BRCA1 or BRCA1 or BRCA2. So really there's two genes. These genes typically function as what are called tumor suppressor genes, and so their job is to stop cells that are trying to become a tumor. But when they are malfunctioning or have a mutation, they don't work, and so women become more susceptible to getting breast cancer.
Do you know what the odds are? I mean, how much more susceptible are they?
So if you carry one of these two genes, your risk over your lifetime of getting breast cancer can be as high as 85%. And actually your risk of ovarian cancer can go up to around 40%.
Well, how do you discover that you have this gene?
So it's very simple. It's actually a blood test. But I don't want to mislead anyone. So most breast cancers are not hereditary. Of all breast cancers, only about 5 to 10% are due to a genetic mutation like what we're talking about. So really, patients need to be screened first. So things that would prompt screening would be breast cancer diagnosed at a young age, multiple family members with either breast or ovarian cancer, men with breast cancer, and anybody who's had breast cancer in both breasts, or what we consider contralateral breast cancer. All of that should raise a red flag for someone to consider getting tested.
Sharon Osbourne, for her, she called it a no-brainer. Is this a procedure you recommend, and is it really a no-brainer?
Well, it's a very serious procedure, and I wouldn't say it's a no-brainer, but I think it's something to strongly consider in a woman who has or carries a BRCA1 or BRCA2 gene mutation, because her lifetime risk is about 85% chance of developing breast cancer. Certainly surgery is, we know there's been a lot of improvements in surgery, but it is something to be taken very seriously. Having said that, if a woman does choose to undergo the surgery, then her risk of developing breast cancer really is negligible, really drops to probably around 1 to 2%, which is very significant. There are other options, such as you take a medication called tamoxifen, which helps to prevent breast cancer, but we don't really know how that works in women who carry these gene mutations. So I do strongly encourage my patients with these mutations to do exactly what Sharon Osbourne did.
It's such a difficult decision, though. I mean, what do you tell them to consider? What do you sit down and say, here's what's ahead in the next few weeks and months?
Yeah, and I think it's really up to the individual woman. I think if she decides not to undergo the mastectomies, then she really has to adhere to a very strict regimen, such as starting mammograms at age 25, starting self-breast exams at age 18. In addition to mammograms at age 25, also I recommend MRI, having a clinical breast exam, a breast exam done by a physician 2 to 4 times a year. So it's a big commitment if you elect not to undergo the mastectomies.
Okay, and what about post-recovery, plastic surgery? Sharon Osbourne said she had sworn off. Is this something that you talk about with patients?
We do talk about it with patients, and they will meet with a plastic surgeon as well as a breast surgeon. And typically what they can do at this point is do everything pretty much in one procedure, and it's extremely safe compared to 10 or 15 years ago. I think when Sharon Osbourne maybe first had her plastic surgery done. Now it is very safe and very effective, and the recovery, it's usually about a month or so, but patients do really very well, and I think in the end are quite happy with the result. At least my patients have been. And Mark, one of the other things I think to consider is peace of mind. And I suspect Sharon Osbourne, that's probably what she was thinking when she said it's a no-brainer. You sometimes just have this feeling this is hanging over your head. When is this going to happen? Are you going to catch it on time? And I think, for many women, they just want to move on with their lives and they don't want to have to worry about this anymore. And so having the mastectomy gives them that security and peace of mind.